Good day everyone, my name is Kanapia by Chihana and I'm here to demonstrate the blood pressure taking. So the definition of blood pressure taking is to ensure exerted on the wall of the arteries when the left ventricle of the heart pushes blood into the aorta. The purpose of blood pressure taking is to determine vascular resistance to blood flow. Also to determine the effectiveness of cardiac muscle if pumping blood to overcome the vascular resistance. So the equipment for the blood pressure taking, we have the sphygmomanometer, the stethoscope, the pen and the paper, and lastly, the cotton with the alcohol. So the first procedure for the blood pressure taking is identify and explain procedure to client. Rationale to ensure right procedure is done. Right procedure is done to client and gain the client cooperation. Good morning, ma'am. Ma'am, ano po pangalan niyo, ma'am?
Angel po.
Ma'am Angel, my name is Chihana A. Kanapia and I will be your nurse for today. So, andito ako ma'am para kunin yung blood pressure na po. The second procedure is the client physical status. Rationale to ensure that the client is arrested and to identify the affected side of the client. So, ma'am, saan po ba yung masakit sa may masakit po ba dito? Kayo dito sa kabila? Sa kabila naman po. So, saan po yung masakit? Wala. Then, the next procedure is determine the client baseline for blood pressure. Rationale for comparison of result during monitoring. So, ma'am, ang pani po kanina, so, ma'am, ang BP niyo po kaninang tanghali is 120/80 po. So, titignan natin kung ano na naman yung BP niyo ngayon. Next procedure, assemble the equipment. Rationale to promote the efficiency of the healthcare provider. Next procedure, wash hands to decrease the transfer of the microorganism. Then, after we wash your hand, the next procedure is place client in a comfortable position, lying or sitting. In the position of the arm at the level of the heart with the palm of the hand facing up, preferably use left arm because it is nearer the heart. Rationale, this position places the branchial artery on the inner aspect of the elbow that stethoscope disc can rest on it conveniently. Having arm above the level of the heart causes a decrease in BP. So, ma'am, upo po tayo, ma'am. Then, the next procedure is wrap the deflated cuff early around the upper arm. Locate the branchial artery. Apply the center of bladder directly over the artery for an adult. Place the lower border of the stop at approximately 2.5 cm or 1 inches above the antecubital space. Rationale, pressure in the cuff applied directly to the artery will give the most accurate readings antecubital space. Then, the next procedure is wrap cuff around arm smoothly and snugly. Not too close, not too tight. Rationale, a smooth cuff and wrapping procedure equal pressure and give accurate readings. A cuff too loosely wrapped will give inaccurate readings. After that, estimate the systolic pressure, palpate at the pulse of the branchial artery. Inflate the cuff and note the readings when the branchial pulse disappear, then deflate the cuff. Rationale, to prevent underestimation of the systolic pressure or overestimation of the diastolic pressure. After that, wait for 1 to 2 minutes before making further assessment. Rationale, to prevent false reading. Next, place the stethoscope earpiece in your ears and close screw valve on the air pump. Rationale, sounds are heard more clearly when the earpiece follow the direction of ear canal. After that, palpitate branchial artery, turn valve clockwise to close the compressed valve to inflate cuff to 30 mm HD above points where the palpitated pulse disappear. Rationally to get accurate result. After that, release the air in the in the in the in the set slowly so that the pressure goes down at the rate of 3 mm HD or second. If the air is too slowly from the cuff, there will be false reading, and if it is released too rapidly, sounds may not be heard at accurate level. After that, listen to the sound or first distinct loud muffling sound in systolic pressure. Continue to release the air evenly and slowly. Last stop muffling sound is this diastolic pressure. Rationally to get accurate result. The next procedure is after the final sound has disappeared, deflate cuff rapidly and completely, rationally to release the remaining air from the cuff and prevent congestion of extremity. Then, roll the cuff and place it in the case. Wipe the earpiece of the stethoscope with antiseptic swab, antiseptic swab, and antiseptic swab and outbag in its proper place. Rationally, this method of removing dirt prevents possible cross-infection of the ear. After that, wash hands to prevent the transmission of microorganisms. Then, evaluation. Next procedure is evaluation. So, evaluate the nature of blood pressure. Rationally to compare from the baseline data. Then, the last procedure is documentation or record the result taken rationally for monitoring purposes. So, ma'am, ang BP niyo po ngayon is 110/. And that's all for the blood pressure taking.